Welcome to the LRS Virtual Conference. This year we have had to run with a very different format, but we are pleased to be hosting 14 virtual and pre-recorded workshops throughout the month of November. The title for our conference is Building Resilience Together, Supporting Mental Wellness, Utilising Sport and Physical Activity. We feel that it is important at this time to support the communities of Leicestershire, Leicester and Rutland to look after their well-being, and we feel that physical activity and sport can play a huge part in helping them to do so. During the current pandemic, the importance of physical activity to support people's well-being has been reiterated by government, with us all being encouraged, where possible, to ensure we continue to lead an active life. In addition, there is lots of national evidence that physical activity and sport can have a positive impact on people's mental wellness. Exercise is often described as the wonder drug in preventing and managing mental health. We want to utilise this conference to raise the awareness of physical activity, sport and the links to mental wellness, and encourage our networks to champion this agenda. It is an opportunity for you to build your networks as well as sharing your expertise and experience with each other. Today's session will focus on setting the scene as to how physical activity can positively support those with mental health problems. You will hear from Carla Burton of Mind, who will outline some of the work they are doing linked to sport and physical activity, with particular reference to their Get Set to Go programme. This will be supported by Dr. Florence Kinnefick, who will share the evaluation of this programme and highlight the many positive outcomes for those who have been part of it. This is followed by a case study presented by Janet Pask, who is the Get Set to Go coordinator with Sheffield Mind. Janet will give an insight into the programme they delivered in Sheffield and highlight some of the challenges faced by the team, along with the positive outcomes for the participants. We will finish today's session with Debbie Butler, who will share her very personal story of her challenges with mental health and how physical activity interventions have made a positive difference to her daily life.
Good morning, everyone. My name is Carla Burton and I'm the Physical Activity Officer and Regional Support at Mind. It is a great pleasure to be part of the Leicestershire and Rutland Building Resilience Together conference. Today we'll be looking at setting the scene of how physical activity can have positive benefits to those with mental health problems. To begin with, I wanted to set the scene by highlighting the statistics around mental health in England. 1 in 4 adults and 1 in 8 children and young people experience a mental health problem each year in England. And on top of that, 1 in 6 people experience a common mental health problem, such as anxiety and depression in every given week. As alarming as those figures are, approximately 1 in 8 adults with a mental health problem are currently receiving treatment. With that in mind, we know mental health problems continue to grow every year. And the amount of people with common mental health problems went up by 20% between 1993 and 2014, between both male and female. We know that this figure may rise during the COVID-19 pandemic. And that's why it's the most important to have this conversation today about how physical activity can play a role in supporting those with mental health problems. I think we can all agree that prioritising mental health has never been more important than it is now. On screen, you will find a snippet of our recent COVID-19 survey that was completed by over 16,000 people. More than half of adults and over 2/3 of young people said their mental health got worse during lockdown. And 1/3 of adults and just over 1/4 of young people did not access support because they did not feel that their issue was serious enough. And those 1 in 4 people of all ages who tried to access mental health support during lockdown were not able to do so. And in our research, we have seen a rise in mental health problems, but also existing mental health problems that have gotten worse. We have seen particular declines in mental health in women, people with disabilities, those living in social housing, people with eating disorders, OCD or personality disorders, and our frontline workers. There has also been a rise in unhealthy coping strategies across children and young people, such as eating or drinking too much. It is important that we understand that mental health problems are different for everyone, that each person is unique, and there are different ways that we can cope with our mental health problems. But what we do know is that physical activity plays a role to support mental health problems. It's common knowledge that physical activity has a positive impact on our physical health, but there are increasing studies that prove being physically active is equally as good for our mental health. In fact, it is so good that the National Institute for Care and Excellence actually recommend it as a primary intervention for mild to moderate depression. And at Mind, we see a real importance for using the power of physical activity to support people experiencing mental health problems. Our vision is to build resilience, to help people stay well, to support people recovering when they're experiencing mental health problems, so that they can live well and tackle stigma through the power of sport and physical activity. Moving on to the impact of getting active has on your mental health. Research shows us that being physically active can reduce our depression by up to 30%. It can really lift our mood through the feel-good hormones endorphins. It can help improve sleep. It can help us lift our self-esteem and manage stress and racing thoughts. Research shows if physical activity is done outside, it is even better. And the University of Essex found that 90% of people who took part in green exercise, having a walk, a run, or doing some gardening, said the combination of nature and exercise is most important in determining how they feel. I've personally found myself becoming even more active during lockdown, taking my cycle out to the local forests and the local cycle routes that I didn't realise existed before. And I know without that opportunity, my mental health wouldn't be where it was today. A Sport England study shows that 65% of people were active to support their mental health during lockdown, which shows that the general public are really starting to recognise that being active is good for their mental health, and it's really fantastic to see. But for those with a mental health problem, they are less likely to be active during lockdown, with 49% of adults saying that their mental health has been worse because they have not been able to take part in sport and physical activity. Over the next few weeks of the conference and in the future, as a sports sector, we really need to come together and provide that support for those people experiencing mental health problems so they can lead active lives. To move on to the why. Why is physical activity especially important for those with mental health problems? Other than what I've just stated on the last slide, those with severe and enduring mental health problems are twice as likely to die from heart disease, 4 times as likely to die from respiratory disease, and on average likely to die between 10 and 17 years earlier than the general population if we have schizophrenia or bipolar disorder. And I know that might be a saddening thing to bring up on the webinar, but I think it's something that it's really important for us all to know. There are a number of factors which contribute to these statistics, which include suicide, poor diet, and social conditions. We may also be slower at seeking help, and doctors may sometimes fail to spot physical health problems in people with severe mental health problems. So it's really important that we encourage those experiencing mental health problems to be active and connect with their communities. The physical activity team at Mind have 3 key programmes that we work on. We also work on other areas such as the mental health charter for sport and recreation and the elite sport. The Get Set to Go programme, which will be covered later in this webinar, is a programme aimed at local minds and their members who are experiencing mental health problems. It is really around community delivery, and the programme aims to support people with mental health problems to find the physical activity that is right for them. We've had 27 local minds who are either currently delivering or have delivered the programme, and they have been funded and supported to provide sport and physical activities for their members. We also have the Football Partnerships programme, which aims at the football community, including fans, staff, players and clubs. The programme aims to improve the way football, sport and society approach mental health by increasing awareness and raising vital funds for mental health projects. The partnership consists of 2 partnerships, including our on-side partnership with the English Football League and the Heads Up campaign with the Football Association, Calm, Sporting Chance and Heads Together. And finally, our sector support programme that is aimed at the sport and physical activity organisations across the region. Our aim is to provide the support so that more sport and physical activity providers are equipped with the skills to support and engage people with mental health problems into regular physical activity. We'll be providing more information on this on our live webinar tomorrow, which is the 4th of November, and hopefully you can join us. There will be an opportunity to ask any questions at the end of the webinar. I hope I have filled you all with the inspiration to take the first step and to support more people with experiencing mental health problems, but giving you an insight to why there is such an important relationship between physical activity and mental health. If you are looking for guidance and information of how to get started, please refer to our sector support guidance and graphic, shown on screen but also available on our website. It will provide you with the top tips for starting your mental health journey, and please access via mind.org.uk/sport. But please do feel free to contact us to ask any questions, and it's important to know that you are not alone in this journey. So I'd like to thank everyone for tuning in and listening today. Please keep in touch, whether it be by the webinar tomorrow or via email or web page that's shown on the screen now. Hope everyone has a wonderful day, and thank you for listening.
Hello everyone. Just wanted to say thank you very much to Leicestershire and Rutland Sport for inviting me for to be part of this seminar series. Sorry I couldn't do this live, but I'm actually teaching right at this minute, so hopefully this recording will be okay and you'll enjoy the talk. So I'm Dr. Florence Kinnifick from Loughborough University. I'm a senior lecturer in exercise psychology, and I'm going to tell you a little bit about evaluating Mind's national programme Get Set to Go. So to give you a bit of a background, first of all, before we go into the intervention, it's well documented that individuals with poor mental health and those who have mental illness have a reduced mortality of up to 20 years. And this is largely due to physical health inequalities. And these are physical health inequalities that can be improved through lifestyle intervention. So, for example, increasing levels of physical activity, improving our diet and nutrition, stopping smoking, so behavioural lifestyle interventions. And what we do know from the evidence and the literature is that community-based, group-based and peer-led interventions independently, so those 3 types of interventions have shown success at improving both the physical and the mental health of those who have mental health problems or mental illness. However, there is limited research that has evaluated such programs as one and looked at how we can improve people's mental health problems within community-based and group-based interventions. And when we're talking about independent evaluations, such as the one that we did with Mind, it's important to look at how community physical activity programs take place in their context. So understanding the complexity of the relationship between physical activity and mental health, and what are those mechanisms that trigger change, so trigger those improvements. How can we understand what is going on in the context of the program to understand what works and what doesn't work? So we did a realist evaluation which specifically seeks to understand those things. So what works for whom, and then in what context do they work, how do they work, and this is specific within complex social phenomena. Okay, rather than kind of your RCTs that are often the gold standard of seeing if there is a cause and effect, the causal relationships, but we want to understand, okay, what works, why does it work, for who does it work, and how does that. Okay, so get set to go. There is lots of information online through Mind's web pages. You can have a summary of the evaluation summary through the link that I've provided here, the academic report, if you want a much longer read. I'm not sure it's much kind of more exciting, but if you do want to have the full read, then the link is there as well. So Get Set to Go, like I said, it was a national physical activity programme delivered and designed by Mind. So we were the independent evaluators. So this programme was designed with people who had lived experience of mental health were at the heart of the designing of the intervention. So it was created with a lot of input from these individuals. So you could, individuals could be referred through a GP or their care team, or they could indeed refer themselves as well. So then they took part in group-based peer-led sport physical activity taster sessions across the country, and these took place in local facilities and outdoor. And there was also an online element with EliFriends, which is an online platform already that exists with Mind, which very much takes on the peer support element. And there was a lot of online information around being active through EliFriends. And further to that, there were some communications and media campaigns that happened throughout the 2 years. So thinking about the local programme, Get Set to Go, there were 8 local Minds in 4 regions across England, in the Northwest, the Northeast, the West Midlands, and also in London. So these are where the programme was delivered. Each site, so each of the 8 sites had a sports coordinator which coordinated the programme, and there was peer-led group taster sessions. So individuals who had who were familiar with Mind services and who had been through Mind services and who had lived experience of mental health, they were helping to lead some of those taster sessions and facilitate those taster sessions. There's opportunities for one-to-one exercise and support as well as the group taster sessions. So 224 volunteers were recruited and trained to provide that peer support. And 3,585 participants accessed the programme over those years. So a huge number of individuals attended taster sessions. So as part of our evaluation, we employed a longitudinal survey over a 12-month period, and this was measuring psychological well-being, social support, motivation to exercise, and also collected some demographic information. So 725 individuals completed our survey. It was a fairly balanced gender, and the ages range from 18 to 20, there's 72, right up to 61 plus years, but I know there was some individuals who were 80 plus who took part and completed the survey. So what we found, so with regards to physical activity, at baseline 28% didn't reach the recommended levels of physical activity at the start before they started the programme. So that's 150 minutes of moderate exercise per week in bouts of 10 minutes or more. So 28% didn't do any sport or exercise on any day of the week, and 82% didn't reach those recommended levels of physical activity at baseline. So what we found when we measured the physical activity over that time, we measured it through a self-report measure in the survey, that individuals did increase their physical activity from baseline to 3 months by 1.5 days. That increased a little bit more at the 6 month, and at 12 months, they were almost doing kind of 1.75 days on average, more than they were at baseline. So this program, it did look like it was improving people's physical activity levels. And I've just included some qualitative data as well. So I'll tell you a little bit more in a second about how much qualitative data that we gathered throughout this time, which was kind of really important to understand the context and kind of how people were experiencing the program themselves. So here I've got a quote that I've included. It's taught me that even going for a walk is a good form of exercise. And one that I found does help my mood rather than sitting at home. So even if I don't have the motivation to go out and do vigorous exercise, a walk is good for me. So even those who may not have gone out to do exercise began to realise that walking even was a form of physical activity that they were able to go out and do, even when they didn't feel as motivated as other times. So in regard to perceived social support and mental well-being, perceived social support did increase significantly over the first 3 months of our data collection. Those completing the data at the 6 month and the 12-month period, the numbers dropped off. So kind of what we wanted, the reliable data over the first 3 months, there was a significant increase. And mental well-being was maintained over the 12 months that we collected that data. And that's really important to try and think about how physical activity may help or work towards avoiding the decline of mental well-being, kind of sustaining and helping to not have that declining kind of long enduring mental health problems. And it helped when we looked at the qualitative data. It really helped people engage in more opportunities and improved kind of the self-confidence, and also reduced elements of rumination in the days that they were active. So particularly this quote I've got is, after you've done the exercise, I feel like, oh, I'm on top of the world. I could take anything on. It calms my mind. It stops me ruminating. It actively lifts my mood, and it makes me feel a lot more positive about life. So I think trying to understand the context of how people experience physical activity, particularly on the day, kind of acutely, it really does help to reduce the rumination. It has a period of time where they don't necessarily have to focus on their problems, or exercise helps to remove that focus to something. So also we implemented the survey to those who were using the online support, and 86% found that information on EliFriends was very or somewhat useful to manage their mental health. And perceptions of mental well-being and social support significantly increased in the first 3 months of delivery. So some really positive outcomes here. So going back to my first slide about a realist evaluation and what we were trying to understand, and specifically using the qualitative data that we collected. And this is just an outline of how we were working to evaluate the programme. So what we wanted to do was understand the context and then add the mechanisms of change which were going on within that context to be able to understand those outcomes and what were the outcomes in terms of intended outcomes and also those unintended outcomes, to try and understand. So how that work is, the intervention is implemented, there might be some triggers which trigger that mechanism of change, and then you have your outcome. So in terms of the qualitative data, like I said, we collected quite a lot. We collected 45 hours of qualitative data, and these were from different stakeholders that were part of the programme. So participants, we held 4 focus groups for each of those regions, which had 13, 8, 9 and 12 participants as part of that. We also conducted 21 online telephone interviews with individuals across the country. And those peer volunteers, so a really important part of the programme, we wanted to understand their experiences and how they, as volunteers, which are a really important part of the programme, part of the design, but also the delivery, and part of the mechanisms of helping individuals make sense of their mental health problems and help them work along the line of recovery. So again, we held 4 focus groups for those peer volunteers, so in the North West, London, West Midlands and the North East, where the local minds were taking place. And we also held 1 focus group with the sports coordinators, which were facilitating the programme within their area. Okay, and what did we find? So what I'm trying to do here is to explain that realist evaluation in terms of kind of what works for who, how does it work, and what are the outcomes. So in terms of the context, we've got the peer-led, group-based, community-based physical activity sessions, which are happening in each of those regions. And how did it work? And for those individuals with poor mental health and mental illness, from a mild to a moderate degree, this is where the programme really had its strongest benefits. There was individuals with a variety of physical health, but those who had severe physical ill health were less likely to benefit. They may not have been able to participate as easier as others in these interventions. Both male and female benefits, and also adults of varied ages. So we had kind of young adults of 18 right up to individuals in 80, 90 plus, 90 years old plus. And under what conditions? So a real supportive social environment was really important. So where individuals felt valued, where they could share their lived experience of mental health and they did not feel judged, they felt connected to those around them. So a real sense of community, that was really important for people getting benefits. Where peer volunteers facilitated physical literacy, so understanding, kind of learning new skills, getting out of their comfort zone, but not too far, so they were able to learn those skills and improve their self-confidence as a result. When there was a clear structure to the programme, that was super important. So when those individuals taking part of the programme knew exactly what was going on, there wasn't, when there was changes to the schedule, kind of last minute, that had some detrimental effects. So having a clear line of communication was really important for those contexts and for when it worked. That was really important. And all these things, these were able to facilitate feelings of self-efficacy, particularly that physical literacy. When people felt they were able to do it, they could achieve. The continuity and stability, how that was really important in terms of how people were experiencing how it worked under those conditions. And it was the mental health and physical activity engagement. So both people's improvements to people's mental health, but also their engagement in the programme and sustained engagement. And I've got quite a nice quote here, thinking about that social environment and how important a supportive social environment, both from the sports coordinator with that clear line of communication, the peer volunteers within the sessions, and also the other participants that were taking part. So it's not somewhere that I'm worried about going back to, because it's going back to that non-judgmental approach. And people say all the time to you, well, you've had that going on, this going on. When you hear that message so many times, it makes it safe for you. So there was a real kind of clear amongst the participants understanding that it was okay not to feel at their best all the time, that they didn't have to pretend. I remember somebody telling us that they didn't feel they had to be on their best behaviour, where they did feel like that, or they had to pretend to be something that they were not, that they felt that they needed to do in other scenarios in their life, unfortunately. So then thinking about who else could benefit within the programme. So again, the context is the peer-led, group-based, community-based physical activity interventions of Get Set to Go. And this time, for who could benefit from this was the peer volunteers, and those who had stable mental illness or mild to moderate mental health problems were those who benefited most within their role as peer volunteers, those who volunteered to help facilitate those sessions. So in what conditions? Again, when there was a clear support process for the peer volunteers, so they knew their roles, they knew their responsibilities within the programme, and they had clear support procedures as well, and regular contact with the sports coordinator, and also had a good relationship with the sports facilities. So the sports facilities may know exactly where to direct participants when they came in. So that was really important, just having a good relationship, clear and kind of practical elements and the logistical elements of those sessions were actually very important, particularly the very first session that participants attended. That was a really key time to make people feel comfortable, feel able like they could come and join the sessions. So how did that work? So under these conditions, how did it work? It improved employability of the peer volunteers. Some from these experiences gained self-confidence in terms of what they could achieve and went on to more volunteering roles and also employed work. Feelings of confidence certainly improved in lots of the volunteers who were potentially quite nervous at the beginning. Stability and continuity, again, kind of knowing what was going on, and if there had to be changes, which inevitably when you're dealing with kind of programs on this scale and different facilities, that you do need to have some changes. But having an understanding of what the process was and how you could get that communication through was really important. Having a good understanding of the role, the feelings of responsibility. So having autonomy over the role and feeling that they were responsible and had a responsibility within the programme was really important to help improve those feelings of confidence. And it was important to establish boundaries within, because it was sometimes quite difficult from the participants and then the sports coordinator and where peer volunteers sometimes felt that they were in the middle of that and they were kind of peers, but they were part of the programme as well. So having those established boundaries, which the training helped with, was really important. And that was important in terms of the retention of the peer volunteers and also the improved mental health of the peer volunteers. So in terms of those outcomes. And again, I've got a couple of quotes. So the first, I've learned that I can do a lot more than what I thought I could. I'm capable of doing a lot more than what I honestly thought I ever could do. I'm learning a lot about myself as well through this. So that was from a peer volunteer. However, it's really important to understand that the peer volunteers are also going through their mental health, their own mental health journeys and recovery, and feelings of responsibility, but not putting the pressure on or them having support on internalizing the feelings of pressure within their role was important to have that support mechanism, because some peer volunteers did feel quite pressured to get it right, to, with that responsibility. So somebody told us, I don't want to make mistakes, I don't want to do something wrong and upset somebody, because like that's the worst thing I want to do is make a participant not want to come back, because that would proper affect me then, because I'd have failed them and I'd have failed myself. So really important not to support those peer volunteers, can't stress that enough, in the design of these kinds of interventions, that those individuals are important for their mental health as well as those participants who are taking part in the sessions. So just kind of the last slide then to finish off. In conclusion, group-based, peer-led community programs with support from mainstream facilities can successfully engage those with mental health problems. And this is by facilitating the supportive social contextual environment, which encompasses the lived experience of mental health problems. That was super important. Various sources of support are important to create the positive environment, both from the sports coordinators, the peer volunteers, and also the other participants. The lived experience, it facilitated that level of understanding and care where individuals didn't feel judged and felt that they just could come along. And even if they had a lapse in their attendance, they felt that they were able to rejoin the sessions when they felt a bit better and they felt more comfortable coming back. It was a clearly structured program with good communication and specific person of contact. That was key, the sports coordinator being the person of contact to provide that continuity and stability for both participants and peer volunteers. And the peer online support is also important for mental wellbeing, but it may not be sufficient in itself to encourage participants to be more active, but it is beneficial for those who are already on their way, improving kind of the elements of social support and their mental health. So those designing peer-led community programs should consider the support process, the specific role and supervision of those volunteering within the program to facilitate their own mental health recovery and also increase the retention of volunteers. So kind of really important part of the implementation of these programs. And physical activity has the potential to improve mental health in people with mental illness within the context of Get Set to Go. However, that positive change isn't a given, and it can be realised with these conducive change mechanisms that we found to work within Get Set to Go. So that's the end of my talk. Thank you very much for listening. I hope you found it useful. Please feel free to email me if you do have any questions. And just some people to thank here alongside Mind, the team at Mind, who have been absolutely amazing over the last 5-6 years to help facilitate our data collection for us to carry out that evaluation. And thank you, of course, to Leicestershire and Rutland Mind for having me speak today. Thank you and see you soon. Bye-bye.
So, hi, I'm Janet Pask. I'm the Get Set to Go coordinator at Sheffield Mind. I'm delighted to have been asked to talk at your conference, Building Resilience Together. I mean, it's never been more needed. So I'm hoping that some of the lessons that we've learned at Sheffield Mind will be helpful in any of the physical activity sessions that you are planning to run in the future. Okay. I'm mindful that because I come from Sheffield Mind, then obviously, you know, we work and support people with mental health challenges. For some of you guys, I imagine actually you'll be interested to try and support people who may come to your sessions who might have mental health challenges. They won't necessarily all have mental health challenges. And there is some training, mental health awareness, or sport and physical activity providers that I think will be really relevant for you, and possibly Florence has already mentioned it, and I've got it as a link on one of my last slides, so do take a moment to look at that. It's 3 hours, it's less than £10, really well put together, professionally put together. Okay, so let's get going. So firstly then, when the programme was put together and funding was sought, the person who did that had already actually built in some of our delivery partners. He'd actually gone around to check that these organisations would want to participate with us. So as a consequence, we had 4 key stakeholders, the community arms of 2 big football clubs, and then also the 2 leisure centres. Of course, we had many more partners than just those 4 in order to be able to deliver this project. We needed people who would be able to make referrals to us. So, for example, then we'd be working closely with some of the voluntary sector. So we have in Sheffield community hubs spread geographically across the city. They're really important. And then also, of course, we'd want to be promoting our activities as well. So, you know, our referral partners also would double as promotional partners, and similarly with our delivery partners. So we're working with a lot of different people. So I know Florence has gone through the what the Get Set to programs or Get Set to Go program is all about. So I just want to briefly go over those elements. So underpinning everything that we did were our peer mentor volunteers, and they were just brilliant. The way that we recruited them meant that, you know, we were seeking people who experienced their own mental health challenges. And we were also seeking those people to have experience of physical activity so that they could enthuse about the mental well-being benefits it gave them. You know, we wanted that enthusiasm to be transferred to any of our participants on our programme. So that was just brilliant. And of course, it also provides a kind of reassurance, if you like, to our participants, because, you know, our peer mentors are kind of coming from where they're coming from. They know what they're talking about. I think that, and so for those individuals, I think that's really powerful. So yes, we ran taster sessions, some 12-week programs, and we had a signposting service. That's what we were specified to do. And of course, because of COVID, which was a shock to us, as to everybody, we had to change what we did. So the first thing that I introduced was a Zoom peer support meeting for people who were on one of our 12-week programs. We got to about week 6 and suddenly COVID happened, the lockdown happened, and that was the way that I thought we could best support people. As you can imagine, you know, people who'd signed up for a 1-hour physical activity program were not the same people who'd be interested in an online peer support group, and that was very much the case. So, and there were a lot of barriers aside from whether people wanted to come to a peer support group. As I'm sure you're perfectly aware of the digital divide, you know, how we have so many people who are digitally excluded, and that's one of our you know, main learning points from COVID. So one of the things that we've done as a result of that is, you know, putting a funding bid to look at how we might support people next time to up to their digital skills, to enable them to have access to the hardware, to get access to mobile data or whatever. So that, you know, that's a major learning point. What we also did was a lot of information provision. So with we had a page on our website, again, that's linked to at the end, how to stay fit and healthy, which would link to lots of other external sites. On there, we also provided information about stuff that you could do just outside, you know, which wasn't online. So, you know, often that would be around walking and cycling and linking into local resources. One of the things about the Zoom peer support was that I was able to provide people with information that was coming in weekly through an email. So even if people weren't participating in the group, they were actually able to find out what we were talking about. And lastly, we tried a virtual couch to 5K using the NHS app, which would take at least 9 weeks for people to go through. We didn't introduce this till August, and it hasn't worked. And one of the things I've learned is that in a physical setting, you can make physical settings inclusive for people by adapting the whatever it is that you're playing. You can adapt the environment and so forth, and you can put support in. When it comes to being in the online world, you kind of, you know, you have to move away from that model in a way, because, for example, with our Couch to 5K, we had a private group on Facebook where we would support people to do that. And you know, even as you're choosing Facebook as the channel, you're automatically excluding those people who don't like Facebook, and you've just got to take that on the head, as it were. You know, you've just got to accept you aren't going to be able to reach everybody. You know, for some people, Facebook contributes to a mental health challenge. You know, being on social media is not a good thing for them. So you know, you've just got to go with it. So that's our actual tasks, if you like. Now, let's move on. Oh, my mouse isn't working properly. Bear with me a moment. Press harder. Doesn't want to move on. Come on. Oh, that's it. So, in terms of just a little bit more detail here about our Tasters and 12-week programs. So, tasters, we wanted them to be places where people could dip their toes in the water if they'd not been physically active for some time. We wanted something that was easy for people to engage with, had to be free, because, you know, many of our participants would be on low incomes. And again, we had to think about where we were actually running these. So we were planning to run 6, so we'd be doing them across the city. And in terms of our 12-week programs, you can just see here, these are photos from when we were working with the leisure centres. So we've got someone playing table tennis, we've got someone in the gym, one of our peer mentors there with Jenny, one of our instructors. And what this is really saying is that we wanted to be person-centered. We wanted to give people opportunities to try different activities, because that's what's going to help keep them on track afterwards. You know, if they can find that one activity that they really enjoy doing, they hopefully will carry on doing it when the program finishes. And that for us is success, for people to be doing sustained activity when they are no longer engaged with us. Okay, so the process. So yes, we'd have to be telling people about our activities. So one of the issues at the beginning was there wasn't very much of a mailing list. Oops, what's happened there? Let's go back. There wasn't very much of a mailing list. Yes, I was lucky because I was able to work with the staff at Sheffield Mind, and you know, we have a support service there, for example, and so they can talk to their clients. But you know, we wanted to be broader than that. We wanted to reach out to many more people than just those who already knew about Sheffield Mind, because it was relevant to so many more people. So one of the things I've been doing throughout is creating a mailing list as I go along, so that when this program comes to an end, you know, at least we'll have a more substantial mailing list to kick off another one when we get funding to continue. Obviously, we're on the website, we use social media. We also had a group that had already established itself, which was really in the health sector and the university sector, as they were kind of ahead of the game, if you like. So there was a group there that we could also link into and promote ourselves through. Sheffield Mind had been part of that group. So the next part of the process was to get people to complete a referral form, and I put a link to that at the end of the slides. At the end of the day, we want people to engage, so we didn't get hung up on people not filling in the form properly. You know, someone could have rung up and said they were interested, and we'd have handled it with a telephone call. And as you can see here, after I had any referral forms, I would indeed be calling people up and having conversations. So for the 12-week program, the kinds of things I'd be talking about would be outlining what the program was to make sure it was something that they were interested in. And then we get to the nuts and bolts of, do you know where the program's happening? How would you get there? If they're a bus user, you know, I would actually go onto Google Maps and be looking at bus routes for them, just to get them right there. And also be talking about finances as well. There's an issue around whether people should pay or not to be part of the program. For the 12-week program, we came up with the idea of a suggested donation. We just had a box on the table so people could put the money in if they wanted to. But for a lot of people, you know, it was difficult. The reason for having a suggested donation was that we wanted people to become accustomed to the fact that, yes, normally you do pay for these activities. They aren't free. So even if you're on a low income, it's about budgeting to manage that, so you could carry on doing it afterwards. With COVID, of course, we decided it would be free because we just wanted to be as contactless as possible. Something else that I did in my phone call was ask people the questions on the physical activity readiness questionnaire, the PARQ. Now, those of you who are fitness instructors will already know about PARQ, and those of you who don't, it's basically 7 questions that you ask any participant. I've just realised that this is going to be on the recording. You can't see what's under there. That you would ask. Let's see, does that's better, isn't it? The PARQ is a series of 7 questions that you ask all participants in relation to their physical health. So if someone had a heart problem, for example, you wouldn't necessarily want them participating at full strength in a particular activity. And if someone answers no to any of the questions, usually the instructor, that person will be encouraged to go and see the GP. I ask these questions on the telephone call because of the difficulties people have in accessing their surgeries often enough, getting to talk to a GP, and I was just trying to preempt that length of time. I had an experience where I was trying to support someone to access their GP, and it was 6 weeks and they still hadn't accessed them. It took a long time to try and, you know, tease out what was going on. And because I was only, you know, I had like a 10 or 15 minute phone call with somebody, you couldn't really develop a proper relationship with someone. You didn't have time, because I was working just 2 days a week, to understand what level of support they needed. I could have rung the GP surgery and asked perhaps for them to do a call back to this person. So yes, so that PAR-Q is important. Now, in any 12-week program, the instructor will actually do that PAR-Q, because that's part of their insurance requirements, and they will want to know so they can adapt exercises and so on for each person. Moving on to the signposting service, same kind of channel, same process, and she would have a long conversation, and the typical things there are around how much, what's convenient for them, how will they travel, what times are convenient for them, and what kind of activities are they interested in. So then we go away and do some research, and then we'd send it back, either email or by letter. Putting stuff in writing, really important, because it can be difficult for people to remember all this information. Okay, so let's move on to the challenges. So challenges for individuals. So obviously they have mental health challenges. As I said, we were supporting people typically with mild to moderate anxiety or depression. And, for people with anxiety, going to new places or doing new journeys, being with new people, can all be incredibly anxiety provoking. One easy way, there are two ways to deal with this, two straightforward ways. One is for journeys and going to new places, do it in advance of that first session. Maybe treat it as a trip, take a friend, go and have a look, go and do that route, so you haven't got that weighing on you the first time you go to a session. Another route out of those issues is around asking someone to accompany them. Have they got a friend or a family member who can help them? Another thing to bear in mind is around when to call people. So if someone's taking medication, for example, they might be taking sleeping tablets, or they might actually just be sleeping very badly. So if you wanted to talk to someone, it's much better to speak to them later on. So at least late morning, if not afterwards. Also, people know themselves. So one of the things that I was interested to know was, what were the barriers that they thought were there for them in terms of participating. And so, for example, I had somebody who said, well, I do have a tendency sometimes when I'm approaching large groups of people I don't know to run in the other direction. And so, he was really open with me about that. And I think that's because he knew I wanted to support him through it. I was able to feed that information to our peer mentors and to the instructor, so they would know that this is absolutely normal behaviour. And people, so it might happen, it might not happen, and if it did happen, then one of the peer mentors could follow this person and help that person just calm down and feel more comfortable afterwards. Okay, another challenge might be motivation, and this can be really difficult, especially for people with depression. So trying to get someone else to accompany them can be quite a powerful way, because then they're letting somebody else down, not just themselves, if they don't and don't participate. Finance I mentioned several times. So they've got to be able to afford the transport. If they don't have if they're using the buses and they don't have a card, a free transport card. Also, that potentially there are entrance fees. I discovered that there are actually discount cards for our leisure centres, and it's not obvious when you first start. I had to write myself a side of A4 on how to work through the process, and support can be needed to help people actually apply for those. And if you're in receipt of particular disability benefits, you may get greater discounts. So it's definitely worth looking at. Transport I've talked about. Last thing, challenges for individuals. Perhaps what to wear isn't a challenge anymore, because so many people now seem to wear tracksuits as part of leisure wear. And indeed, that's what I found. It wasn't an issue. You just wear something comfy. But for people who haven't been active before, it can be something that can be anxiety provoking. What am I supposed to wear? So it's a conversation to have, but usually it turned out not to be an issue. So that's challenges for individuals. So challenges for us. So initially, finding participants was a bit of a challenge, because I was kind of starting from scratch. Obviously I could tap into our local staff within Sheffield Mind, But you know, you still have to find people who do want to participate. It's not a foregone conclusion. Florence, I think, talked about the evaluation of the project, and I have to say that was a bit of a challenge for us. I won't labour the point because I'm sure Florence has gone over it, but it was difficult. We did have people who, you know, would have literacy challenges, and people did need support in completing the applications. There were some rather personal questions being asked, and if you were having a bad day, you know, the last thing you wanted to be asked with some of those questions, it would just make you feel worse. You know, we're always very open and said, just don't answer the questions if you don't want to, but you really don't want those kind of questions in the first place in the perfect world. I mentioned briefly earlier about the lack of a therapeutic relationship, you know, not having enough time to get to know people. So that was a challenge. And in our perfect world, it'd be nice if we'd had time to set goals with people as well. You know, if you set goals with people, however small, when they meet that goal, they feel like they've achieved something, boosts their confidence, then they can set themselves another goal. And that way, step by step, they can start really making changes in their lives. You know, that's one of the powers of physical activity. COVID was obviously a challenge for us. I touched on that earlier. And I did also mention trying to do all these things in 2 days a week was a bit tricky. You know, juggling quite a lot of balls and having to get it all done just on those 2 days. So lessons, I would really encourage you to develop a mailing list from the start. All the programmed activities need to be fun, low cost, have good transport links. Building a healthy lifestyle session, because you've already got this group of people together, that's really you know, quite expensive to do that. You might as well put in this extra element because people are often interested in this. I mean, obviously you touch base with them, but I think you'll find that generally people, even though they might sound hesitant, will sit there and be interested. I've mentioned several times about encouraging someone to accompany a participant, you know, just to motivate them, help reduce anxiety and so on. And I'd encourage you to, you know, actually talk. This is face-to-face talk if you can, definitely a Zoom call or equivalent, with local mental health NHS Trust occupational therapists, because they're often looking for activities that people can join in. And in fact, with us, with our second 12-week programme, we met up with some occupational therapists. I should mention here, outtake, I am an occupational therapist. We met up with them and talked about the programme, and the manager of the team said to her colleagues, okay, folks, what I'd like you to do is to support 2 people each to come along to this programme. So it was their task to find some of their patients who could come and benefit from our sessions. And that worked really well. You know, it was a really good group to tap into. And also you'll find probably that you've got some mental health focused voluntary groups. We've got one called Sheffield Flourish, for example. So it's not a national group, but with a little bit of digging, you'll be able to find them. Go to your local voluntary action centre, they'll be able to help you, you don't know. And the last point here is about developing strategies for working with people who aren't digitally active. Okay, no one's actually cracked this one, so it's just on the list. It needs to be done. There's still lots of learning and testing that needs to happen. Okay, I'm now onto my resources sections, so whiz through this. So these are 2 pages out of the referral form that you might find interesting to use when you're short of time to have proper conversations with people. The first bit is about the barriers. You're asking people to identify barriers that may get in the way for them. And it's really easy because we've listed lots of barriers on there that people might not have thought of before. On the right is just a checklist really of what people's physical activities have been and what they'd like them to do. Here are some more useful resources all online. So these are some of the Get Set to Go things from us. Here are some National Mind links. And then here, I think sometimes people, I'm talking for myself here because I didn't start working with disabled people in a meaningful way until 2007. And I can remember feeling very awkward about it. And I really like this Scopes campaign here, which is helping to break that ice, if you like. And then Sport England's really good in terms of their support for coronavirus. And then here's, if you're interested in finding places which are online and it's a way of people being active at home, here are some links, really useful links there, which are constantly being updated. finally, thank you so much for listening. I hope this has been helpful to you, and good luck with all that you do. Thank you so much.
Hello, my name is Debbie. Thank you for tuning in to listen. I really appreciate it. Before I begin, I would ask you to take a few seconds or a few minutes to think about an event that might have happened in your life, whether it was as a child or as an adult or as a teenager. These times in our life can be very traumatic. People deal with things in different ways. I just want to share with you today several of the traumas and events that have happened to me in my life. As a child, my first memory was sitting on the edge of a hospital bed, screaming for my parents. In those days, of course, parents weren't allowed to stay with their children. It was a traumatic event for me, and that event, although I still see myself sitting there, happened a long time ago. I don't think I really ever bounced back from that experience. Of course, in those days, the hospitals were far more strict with their patients. And as a child, it was very scary. Maybe the event that you're thinking about in your life happened as a child. Did anybody ever talk to you about that event? How did you bounce back from it? Every one of us has resilience. It's how we apply that resilience. I'm not very good at it at times. I often sit here and think, why has that happened again and again and again? But believe me, it's not easy, but you can do it. I'm 63. I've had a lot of things happen to me since I was born. I was born with severe anemia. My parents didn't find this out until I was 6. I was thought to be a very quiet child because I didn't have the energy or the wherewithal to play. I have a twin sister who is a lot more energetic, or was, I should say, a lot more energetic than myself, and really took over the limelight because I was quiet. I just sat and played with one toy, so I'm led to believe. After many years, my mum had to take my brother to the GP for something or other, but the GP was more concerned about me as I was taken along with him. I ended up in hospital the next day having tests for anemia. These were confirmed, and I had to go to hospital every other day for 6 weeks, I think it was. Little did we know that this was probably the reason why I wasn't walking. I used to go to school in a pushchair until I could walk at the age of 6. I remember, again, one of my first other memories was attending school, turning up in a pushchair when people and children that I knew would come and greet me. For some reason, these memories are all in black and white, but in those days, of course, television was only in black and white. And although these events didn't happen on television, most of things in that time were black and white, photos included. Resilience is how we deal with these events, and at times 9 out of 10 of us have no control over what happens to us. It's very difficult to decide on how we're going to deal with things. For me, being resilient, bearing in mind I'm not trained in psychology or anything like that, I've just bounced back. Some of my friends call me stubborn. Some of them call me resilient and determined. I'd like to believe that I am determined, but on bad days, that doesn't come through. Let me start by telling you a few of the events that have happened to me. As a child, I was really quite poorly a lot of the time and missed an awful lot of school in the early years. And of course, those early years at school help you develop in your education. And going through until senior school, I was quite far behind with my academic achievements. Senior school, I believe I started with very little reading experience, and my parents, who at the time were both teachers, used to keep me in. I wasn't allowed out to play at times, so I could do extra homework, which as a child, when your siblings and your friends are outside playing and you can hear them, all you want to do is to be with them. So as a child, that was difficult again for me, being in a room all on my own, having to do stuff that I didn't really like or didn't really understand. School was quite difficult for me, because I think mainly because I was thought to be not very intelligent because of my missing school. Little did people know in those days that I had missed school a lot, and therefore my academic achievements were low. Having left school, I managed very quickly to obtain a job. I'd left school with no qualifications except for one CSE in those days with music. So that wasn't going to get me far. But I did manage, and very luckily, to secure a job. I left school on the 17th of July, I think it was, 1974, and started employment on the 17th of August. So I had a few weeks off, which was good. My first job was in an office in not far from where I live, and I hated every minute of it. I didn't like the people. I didn't know how to relate to those people, but it was a job, and my parents needed the money for me to pay my board and lodgings. So anyway, I stuck this out. A few years later, it was a difficult time again. My father had been taken very ill just after I left school. He'd gone into hospital with kidney failure on the same day that Princess Anne got married to Mark Phillips, I think it was. So that day was quite memorable. Little did we know how it would pan out, where eventually my dad was on kidney dialysis, and we had a porta cabin put into the back garden where the kidney machine was situated. The kidney machine was very large. What you see today in kidney dialysis is very small. In fact, I believe they're portable. Some people wear them around their waist. But in my father's day, when he had dialysis, it was as big as a table, the machine. There was still there were two machines. There was one that took the blood around, and then there was the kidney, which we, as relatives of my dad, were taught to clean and reassemble and test. And if the test didn't work, then we would have to clean and reassemble the machine again after my dad had been on dialysis. I don't remember enjoying doing that. It was quite difficult because my mum had a lot of responsibility about attaching my dad to the machine. She had to learn to give him injections and all sorts of nasty little things. And she slept in the cabin with dad during the night time when he was on dialysis. Dialysis lasted for a few years. 4 or 5 years later, he was lucky enough to get a transplant. By this time I was 21 and looking forward to my 21st birthday, which we had. Dad was in hospital when I was 21. I went to visit him, and one of his final words to me was, "Will you give me a kiss before you go?" Little did I know that would be the last time I saw him alive. I didn't give him a kiss because we're not a touchy, close family like that. I regretted that for many, many years, that I'd not kissed him on my final time that I saw him alive. That was difficult for me because my dad was a music teacher, and I luckily have acquired some of his musical talent, which has helped me through a lot of things. Dad died of a heart attack a week after my 21st birthday. I was devastated. I didn't know how I would bounce back from that. But my mum was very stoic in what she told us we could and couldn't do. So Dad died on the Saturday, and I returned to work on the Monday. I didn't want to go to work, but my mum had forced it on us that we should return. That was very difficult, but it gave me something else to think about. So the funeral was not very nice time. Funerals aren't. I attended along with my brothers and sister, my mum, and a lot of family. I did remember thinking, though, the church was full. My dad was a teacher, like I say, and he was well known in the education department, where he was able to have many friends and acquaintances who attended the funeral, which I remember walking down the aisle behind the coffin, feeling very proud that I was his daughter. Life after that came and went. I was in and out of hospital every year almost of my life, with something or other happening to me physically. I have had multiple stomach operations, multiple leg operations, and many, many mental health appointments. My stomach operations were because I was always in pain in my stomach. And it wasn't until many years later, after all the operations that they discovered I had celiac disease. And that was only discovered after I had a mini stroke. The mini strokes also came with another diagnosis of a blood clotting disorder called protein S deficiency. This means that my blood will clot, so I am on blood thinning tablets, which are not difficult to take, but I will be on them for the rest of my life. Before the medication was deemed to be working, I had 3 mini strokes. While I was pregnant with my daughter, I also had a deep vein thrombosis in my left leg, which could have been quite life-threatening had they not discovered it until too late. The pregnancy itself for my daughter, she was born prematurely, 7 weeks early, weighed in at a massive £3.14. And again, when she was first born, I thought, if this is having babies, then I'm going to have a big family. I came from a big family and always wanted a big family, but that wasn't to be. My daughter was born on Saturday morning. By Saturday evening and Sunday morning, it was as though a brick wall had hit me. I didn't want her. I didn't love her. I just wanted to go back to being normal. You may say this is often what new mums think. This was different. It was totally wiped me out. The psychiatrist that came to see me while I was on the ward still after my daughter was born, I think was quite concerned. I was on medication within 2 days of my daughter being born, and only came off medication 2 years ago on the antidepressants. So the last 2 years I will talk about later. After my daughter was born, again, it was difficult because, like I say, she was born prematurely. That was difficult to deal with because luckily she wasn't too ill. She was born with severe jaundice, so she was under phototherapy for a few days. So she couldn't suck, so she was tube fed, which did damage her nose, and to this day she still suffers. She can't breathe through her nose to this day. So life, as I say, did go on. The clock always ticks, the days always go, the next day arrives. It's very difficult. So after that, my physical health was again quite poorly. I was again in and out of hospital a lot of the time. I had what looked like a brain tumour, but it turned out to be something called Bell's palsy, which paralysed one side of my body, mainly my face, for quite a while. So I was on a massive dose of steroids to get rid of that, and luckily I did manage to get rid of it. There were other things happened apart from my health in my life that have been quite traumatic. My mum was taken very ill. She had a hip replacement, ended up in an old people's accommodation, and never really recovered from her first hip operation. She had massive ulcers on her legs as well, so found it very difficult to walk, which she found very difficult to cope with, I think. I was working at the time and I'd managed to get myself involved in mental health research. That was really good. And my skills and my confidence built up. And things seem to be getting better. It was only after my my mum had died that I felt different. It was difficult. Not having any parents at any time of life is not easy. But I did find it difficult to come to terms with the fact that I had no parents. But one good thing that's happened since lockdown, my sister and I talk every day, and the relationship there has become quite more enhanced. So going back to work, I became involved in patient public involvement, worked in research, mental health research, developed skills around the research process, and developed skills around being able to talk at meetings where people were deciding on other people's lives. So I enjoyed that work, I really did, and I managed to get further into it. I got myself a job working for an organisation called the Mental Health Research Network, which unfortunately no longer exists, but it gave me a good starting point to where I am today with mental health research. Other things, my daughter grew up and went to school. That was fascinating, and she really, really enjoyed her schoolwork until she started senior school. She didn't like senior school. I don't think it was difficult for her. She did have friends, but in her final year there, she was bullied quite badly and indeed didn't finish the last year of school. She took her exams, didn't manage to get many, but then with her resilience, she went back to college and discovered how clever she is and managed to get up to university as well. So I'm very proud of the fact that she managed to bounce back from that. So all the time I talk about bouncing back. These things are hopeful. Events happen to everybody. Every one of us has had something happen which has dislodged our feelings and emotions. It's difficult to come back sometimes. I've had other things happen to me. Work-wise, have not always been great, but since I've become working in mental health research, working for different organisations, and the university has made me feel much more better about myself. So I've told you an awful lot about my physical health and my mental health and how things have happened to me over the years. But the last 5 years have been different. Things have still happened. My mood has still been low. My emotions have still been running riot with me. One day I can be good, the next day I can be suicidal. So almost 5 years ago, not long after my mum died, I decided I would spend my mum's money that she left me and go to university. So I was lucky enough to get a place, but little did I know that at the time I wasn't emotionally well enough to actually complete the course. So that was disappointing for me, but these things happen. And yes, when I was there, I discovered sport. And I was lucky enough to meet a very inspirational lady who managed to arrange somehow for me to attend an aquarobic session at the University of Nottingham. This I did very reluctantly, and it was only the fact that I saw my friend drive up in the car as I was about to leave the swimming pool before the event, that she ushered me in and told me that, she'd be there and I would be fine. I hated every minute of that first aqua session, but I really, really was inspired by this lady that managed to keep me going. She suggested we started going to the gym. Now that for me at 58 was quite a terrifying prospect. I did that though. I started to go to the gym. I loved it. The first few times I went, I thought, oh, everybody would be looking at me, all these students, young students looking at me, but I've learned now that they're all there. They all have their headphones on or in their ears, and they're listening and getting on with what they want to do. So I can do that any day now, attend a gym. although it's difficult at these weird times that we're living in. So my journey from acquiring my skills in the gym, I used to go to the gym one day, then I would go swimming, and then doing that in rotation for quite many months. During that time, I met many inspirational people who have helped me and helped me develop my skills. The lady I told you about, Hannah, she has always been there. She's been very helpful in a lot of things. I was asked a few years ago now to talk about my story from one of the strokes I had. I ended up in a wheelchair because it happened after an operation. So I was asked to talk with the physiotherapy department at the university to their students about my journey from sitting in a wheelchair to actually going to the gym and getting to where I am today. Another good thing, when I attended the gym to start off with, I was very heavy. I couldn't move really well. My diet was appalling, and I didn't do any exercise until Hannah persuaded me to actually go to the gym. As I say, I fell in love with it, enjoyed every minute of it, enjoyed Hannah's company, enjoyed company of other students that I've met along the way. And my love of sport actually kicked in, and I discovered badminton. Badminton to me at school was always really good. I enjoyed playing it, not to any good, brilliant standard, but I enjoyed playing it. I met up with my badminton coach, and he, with other people, has been very inspirational and helped me many times to get through the difficult times. So today I play badminton as often as I can, but like in the weird times that we're living in, we're just about to go into tier 3, so it may be that gyms and sports halls close, but they will reopen and we will be fine. Badminton has been great. Initially, when I first went on court with my coach, I couldn't walk backwards, let alone run backwards. Today, 4 years later, I can do both. And I'm very proud to say that because of all the sport I did, because I've changed my diet, I'd now lost 5 stone and 5 dress sizes, and look and feel a lot better. So that has been a big godsend in my life. Discovering sport at the age of 58 was brilliant. Along the way, because of all my multiple leg operations and my strokes, my legs are relatively still weak, but not half as weak as they were. I have a brilliant physiotherapist who helps me with that. See her quite often. So things are looking up until we arrived at lockdown in March of this year. I found it difficult to begin with, like a lot of people. Many of you in the audience will have felt the same. It was difficult, but once I thought and understood that it wasn't just happening to me, that it was happening to everybody on the planet almost, then I managed to accept the situation and get on with it. So during lockdown, I managed to write a lot, which is another way I managed to help with my emotions. I was lucky enough to get many of my blogs published on the Institute of Mental Health website and other places as well. I started to do some work with Mind, the mental health charity, and over lockdown did some work and writing for them too. So that was good. I managed, because of the good weather that we had in the beginning of lockdown, I managed to keep exercise in the back garden that I have at my house. So that was nice. But I also discovered walking. The first few weeks of lockdown, I didn't want to go out of the house. It was like a big monster waiting for me outside, and I was frightened to go out of the house. But with my daughter and the rest of my family persuading me to go for a walk each day, I suddenly discovered that after not walking till the age of 6 and multiple leg operations and strokes, that I love to walk. So we're now, I forget what week we're in, but I and my partner have walked over 750 miles since March. And I would like to think that I could raise that figure up to 1,000 before Christmas. So today, I haven't done any walking, say that, because I've been to play badminton, but I'm hoping to go for a walk later this afternoon. Walking has been brilliant. I've kept my weight down. I've kept my mind occupied. It's a big distraction, keeping my mind active and away from the weird and unforeseeable future of what we're living in today. The last few weeks have been tough. Since coming out of lockdown, Nottingham has been at the top of the game with figures, which has been quite scary. And as we are going into tier 3 in the next few days, my concern is that gyms, sports halls may close. But I am a lucky one. I have a back garden. I can go running. I can go walking. So that to me will keep me going, as well as having lots of conversations with lots of different people. It's not always easy to reach out when you need help. I tend to find that really difficult, reaching out to people. I've always had problems with relationships, understanding relationships. As a child, I never had many friends, and all through my life, I found it difficult up until I discovered sport. I discovered people who are in sport are inspirational people. And working as a team with many of them as I do, I find I can help them too. So resilience then is quite an individual thing. But what I'd like to say to you today is that whatever comes your way, the clock still ticks, the days still go, and you will come out of it, and you will be such a more stronger person than you believe in many, many years that you are. I still don't believe that I'm a strong person. I've had lots of things happen to me. I've had lots of operations. I've had lots of miscarriages. I've had lots of things happen. But today is a tough day for me emotionally, but I'm still here. And I hope I can be inspirational to other people as they have been to me. So I look forward to hearing any comments from you guys, and I hope that some of what I've said will help you to be resilient in your life. Bounce back from things. Things do happen. We all have things happen in our life. I'm not by any means taking monopoly on events happening in my life, but I've had a few. But one of my other friends has also said to me that I wouldn't be the person I am today if I'd not had those events happen in my life. So thank you for listening, and I hope that some of what I've said can go to making your day a bit better. Thank you and goodbye.